Do you know the top signs of liver damage? Let's delve into the importance of liver health. This mighty organ, tucked away in your abdomen, is a powerhouse that performs over 500 essential functions. It filters toxins from your blood, aids in digestion, regulates blood sugar and cholesterol levels, and helps fight infections. The liver is also incredibly resilient. It can regenerate its own cells, making it possible to bounce back from a certain level of damage. However, continuous strain can lead to severe complications, even liver disease. Recognizing the signs of liver damage is vital. Why? Because early detection allows for timely intervention, preventing further harm and in some cases even reversing the damage. It's not about living in fear, it's about being informed and proactive when it comes to your health. So, it's crucial to be aware of the top signs of liver damage. Starting with sign number 10, abdominal changes. An important sign of potential liver damage is a shift in your abdominal comfort and appearance. Your liver, situated in the right upper quadrant of your abdomen, plays a pivotal role in digesting food, storing energy, and removing toxins. When it's under duress, you may begin to notice some changes. Bloating or swelling in the abdomen can occur, often accompanied by a feeling of fullness or discomfort. This happens because a damaged liver struggles to process substances, leading to a buildup of fluids in the abdomen, a condition known as ascites. Pain or discomfort may also be felt in the area around the liver. It's important to note that these symptoms can be subtle and may easily be mistaken for general indigestion or a stomach upset. So if you're experiencing unexplained abdominal changes, it might be a sign of liver damage. Understanding your body and recognizing these changes early on can be vital in managing liver health. Moving on to sign number 9, jaundice. Now you might be wondering, what is jaundice and how does it connect to liver damage? Jaundice is a condition that causes your skin and the whites of your eyes to turn yellow. This yellowing is due to a buildup of a substance called bilirubin in the blood. Normally, our liver filters out bilirubin as part of its many functions. However, when the liver is damaged, it may not be able to effectively remove this substance, leading to its accumulation. This is where jaundice comes into play as a possible sign of liver damage. It's also important to note that jaundice can result from other health issues, such as blood disorders or gallbladder disease. So, if you notice any yellowing of your skin or eyes, it's crucial to seek medical advice promptly. Jaundice, though commonly associated with other health issues, can also be a sign of liver damage. Sign number 8 is changes in urine color. Now you might not pay much attention to it ordinarily, but your urine color can serve as an insightful indicator of your liver health. If your liver isn't functioning properly, it could lead to dark or brown urine. This happens because your liver is responsible for breaking down old or damaged blood cells, producing a byproduct called bilirubin. When your liver is healthy, it effectively eliminates bilirubin from your body. However, when your liver is damaged, bilirubin may not be properly processed. This can cause it to build up in your bloodstream and eventually be excreted through your urine, resulting in a darker hue. Changes in urine color, especially if persistent, should not be overlooked. They could be indicative of a more serious underlying liver condition. Of course, other factors like dehydration can also lead to darker urine, but consistent changes are worth noting. So, keep an eye on your urine color. It can tell you a lot about your liver health. Now let's talk about sign number 7, changes in stool color. A healthy liver produces bile, which aids in digestion and gives our stool its typical brown color. When the liver is damaged, it may not produce enough bile, resulting in pale or clay-colored stool. On the other hand, if there's a blockage in the bile duct, excess bilirubin can build up in the body and turn the stool a darker color. In severe cases, you might even notice your stool turning a tar-like black. This is due to internal bleeding, a serious condition that requires immediate medical attention. Occasionally, you might also see blood in your stool. This could be from a variety of sources, but if it's associated with other signs of liver damage, it's crucial to seek medical advice promptly. So, be observant. Notice if there's a consistent change in your stool color that lasts for more than a couple of days. It might just be your body's way of signaling a problem. Remember, changes in your stool color are not to be ignored. Sign number 6 of liver damage is itchy skin. Now you might be asking, what does your skin have to do with your liver? The answer lies in the liver's role in detoxifying the body. When the liver is damaged, it struggles to filter out toxins effectively. These toxins can then end up in the bloodstream and eventually your skin, causing persistent itchiness. It's not the occasional itch we're talking about here, but a constant nagging itch that doesn't seem to go away no matter how much you scratch. This itchiness can occur anywhere on the body and is often worse at night. It's important to note that while itchy skin can be a sign of liver damage, It can also be a symptom of many other conditions, so persistent itchiness, especially if combined with other signs, might indicate liver damage. Halfway through our list at number 5 we have fatigue and weakness. Now these are symptoms that can easily be brushed off as signs of a busy lifestyle, but did you know they could also be indications of liver damage? You see, your liver is a vital organ that performs hundreds of essential functions, including filtering toxins from your blood and storing energy. When your liver is damaged, it can struggle to carry out these tasks, resulting in a feeling of chronic fatigue and weakness. It's like running a marathon with a backpack full of bricks. Your body has to work harder to perform basic functions, and that extra effort can leave you feeling drained and weak. This isn't just a case of feeling tired after a long day, it's a persistent lingering fatigue that doesn't improve with rest. It's a weakness that feels like you're hauling around those metaphorical bricks. So, if you're feeling consistently tired or weak, your liver might be sending you a message. Sign number 4 of liver damage is loss of appetite. Now we all have those days when we're just not feeling up to eating much. But what we're talking about here is a persistent lack of interest in food, or even sudden weight loss. This is not about skipping a meal or two, it's about consistently finding yourself not wanting to eat, even when it's been hours since your last meal. But how does this relate to liver damage, you may ask? Well, an unhealthy liver can disrupt the body's normal digestion and metabolism processes. This can result in feelings of fullness or nausea, which may deter you from eating. Over time, this could lead to significant weight loss, which is not the kind of slimming down anyone wants. Remember, the liver plays a crucial role in our body's overall health. So, when it's not functioning properly, it can send out distress signals, one of those being loss of appetite. A sudden loss of appetite can be more than just a passing phase. It could be a sign of liver damage. Moving on to sign number 3, nausea or vomiting. Now it's common to feel nauseous or even vomit when you're not feeling well. But when these symptoms persist, it could be a sign of something a lot more serious, like liver damage. You see, your liver plays a crucial role in the digestion process. It produces bile, a substance that helps in breaking down fats and eliminating waste materials from your body. However, when the liver is damaged, it can't produce bile as efficiently. This can cause a buildup of toxins in your bloodstream, leading to feelings of nausea and persistent vomiting. It's important to note that these symptoms can also be caused by other health conditions, so it's crucial not to jump to conclusions. But if you're experiencing persistent nausea or vomiting along with other signs we've discussed, it may be time to consult a healthcare professional. So, persistent nausea or vomiting should never be ignored, as it could be a sign of liver damage. Sign number 2 of liver damage is swelling in the legs and ankles. Now, it might seem odd that an organ located in your abdomen could cause swelling in your lower limbs. Here's how it works. The liver plays a vital role in producing proteins needed for blood clotting and fluid regulation. When the liver is damaged, it can struggle to produce these proteins, leading to fluid imbalance. This imbalance may cause fluid to accumulate in the legs and ankles, a condition known as edema. It's like when a dam can't hold back the water, it floods the surrounding areas. Similarly, when your liver can't keep the fluid in check, it spills over into your legs and ankles. This swelling can be uncomfortable and even painful. It's not just an aesthetic concern, but a serious symptom that shouldn't be overlooked. If you notice unexplained swelling in your legs or ankles, it might be your liver asking for help. Finally, the number 1 sign of liver damage is bleeding or bruising easily. This might seem surprising, but let's delve a bit deeper to understand why. You see, your liver plays a vital role in the production of clotting factors. These are proteins that help your blood to clot and prevent excessive bleeding. When the liver is damaged, its ability to produce these clotting factors can be compromised. This can lead to a condition known as coagulopathy, where the blood doesn't clot as it should. As a result, even a minor injury might lead to prolonged bleeding, and you may notice that you bruise more easily than before. This is not about the occasional bruise from bumping into furniture or the normal bleeding from a small cut. We're talking about bruises appearing without any known cause or wounds that continue to bleed longer than they should. So, if you find yourself bruising or bleeding easily, it's time to pay attention to your liver. Those were the top 10 signs of liver damage. Let's quickly recap them one more time. Abdominal changes, jaundice, changes in urine color, changes in stool color, itchy skin, fatigue and weakness, loss of appetite, nausea or vomiting, swelling in legs and ankles, and lastly, bleeding or bruising easily. It's crucial to remember these signs because early detection can make a significant difference. If you're experiencing any of these symptoms, it's not a time to panic, But it is a time to take action. Schedule a visit with your healthcare provider. They can help to determine if these signs are indeed indicative of liver damage and can guide you on the appropriate course of action. Don't underestimate the importance of your liver health. It plays a vital role in numerous bodily functions. Remember, it's always better to be safe than sorry. Remember, your health is in your hands. Stay informed, stay healthy, and always listen to your body.